Vitamin D. What level is acceptable? When should I take vitamin D? What dose should I take? Let's discuss. So to begin with, let's understand that vitamin D is one of the 4 fat-soluble vitamins alongside A, E and K. Vitamin D is a homeostasis with calcium and phosphorus or phosphate, and therefore we measure those when we are assessing vitamin D deficiency. It circulates in the body in 2 forms: vitamin D3, also known as cholecalciferol, and vitamin D2, also known as ergocalciferol. Now, how do we acquire vitamin D? It is synthesized thanks to the ultraviolet B radiation from the sun, and a good 80 to 90% of it is actually synthesized through this route. The remainder 10 to 20% we acquire from our dietary intake, so by consumption. When we perform blood tests on a patient, we measure 25 hydroxyvitamin D level, and the acceptable level is anything greater than 50 nanomoles. When the patient has a level between 25 and 50, that can be considered insufficient or inadequate. The inadequate levels are less than 25, and in those situations, when we have that low level, that's when we consider the patient being at risk of vitamin D deficiency. So less than 25 is deemed inadequate, and the patient is deemed to be at risk of vitamin D deficiency. Now, vitamin D deficiency in adults will lead to osteomalacia. In children, this will lead to rickets. The other complications that you may well get from vitamin D deficiency is osteoporosis, which is a reduction in the bone mineral density. This is not the same as a weakening of the bones, please. Osteoporosis is increased fragility of the bones, not even increased brittleness, which is also different. And finally, the patient may be at greater risk of falls because the bone strength is not so much there, and therefore they cannot support the framework, and or they are at greater risk of fragility fractures. Now, fragility fracture by definition is a fracture that would occur on the back of trivial trauma at a height equal to that of the patient. Okay, so there's our complications. Risk factors, there are a great number of risk factors, but those that are perhaps most common are age, greater than, well, in females greater than kind of 60 years of age, 65 in males, but this needs also to be considered in the context of early menopause or the likes of procedures such as hysterectomies in ladies. Why? Because the estrogen protective factor on bone is no longer present, unless of course they have had some HRT. The other risk factor is your medication, so iatrogenic causes, and finally dark skin. So patients who have darker skin are unable to absorb as much of the UVB radiation from the sun as are those of lighter skin, such as our Caucasian counterparts. Now, how do you prevent all of this? And how do you treat it? So what we do is we can give a loading dose of vitamin D. Now, it's important to consider this because vitamin D is very readily available out over the counter, including the higher doses. And you can get vitamin D toxicity, so please be mindful of this. Now, the clinician, and this has to be carefully monitored and supervised. I would absolutely discourage anybody purchasing loading doses of vitamin D over the counter and self-treating. So this is purely for purposes of kind of awareness rather than education in its entirety. A loading dose of 300,000 IU international units is what we would give as loading dose. I'm not going to disclose over how long, not in a given situation, because like I said, they should be supervised. Once you've given the loading dose, then you will administer the maintenance dose for 1 month, and that maintenance dose is 800 IU or on a daily basis, unless there are patients who have got certain risk factors. Finally, once you've had that, you can then drop down after that month to a daily dose of 400 IU. So the situational guidelines may be that your 400 IU is recommended in all age groups, particularly in the winter months, and those days where because in the autumn and winter months, because the days are shorter, the sun is rather limited. So there you are. That can be considered all year round, but particularly those patients who are at greater risk need to have higher doses. Again, they should be carefully monitored. All of these medications are available over the counter and therefore can be treated. I hope that was helpful. Thank you for watching. Vitamin D doses explained in a nutshell, and what levels are acceptable and how we go about managing this. Thank you for watching.